Hola everyone, my name is Gabby y bienvenidos a mi YouTube channel. I'm so excited to make this video today because I remember being in high school and not knowing where in healthcare I would fit because I wasn't interested in becoming a doctor or a nurse. But today I'm going to be sharing with you 5 non-clinical roles that you can pursue in healthcare. For each role, I'm going to be answering 3 questions, and those are: what is it? What is the average salary in the USA? And what is the education that you need to do that career? The first role is a healthcare attorney. So what is a healthcare attorney? It is a lawyer who helps clients with legal medical issues. That means sometimes handling malpractice cases, either from the doctor, hospital side, or from the patient side of things. Or if you are an in-house attorney, which means that you only work specifically for the issues of a specific hospital, then you are assisting them with things like contracts, employment issues, etc. The average salary for a healthcare attorney is $99,000 a year, but it ranges from $65,000 to $158,000 a year. Obviously, this depends a lot on region and experience, etc. So it's hard to pinpoint exactly where you would fall in that category if you decide to pursue this career. But the education that you need is a bachelor's degree, not in any specific field because you don't need a specific degree to get into law school. But if you pursue a degree that is related to healthcare, that'll probably help you in your career later on. And then after that, obviously, you would have to go to law school, become an attorney, and pass your state bar. Career number 2 is healthcare administrator, which is what I'm going to be doing now that I've graduated college. This title covers a lot of ground, but essentially these are the leaders of the facility. So they are helping planning, coordinate, and direct healthcare services. They are managing the operations of the hospital or specific departments. They are helping develop different policies to improve the efficiency and quality of the services provided in the hospital. They are training different staff, and they are also representing the hospital. So they are the ones that go to the conferences and are the face of what the hospital is or the healthcare organization that you work for is. The average salary for a healthcare administrator. I'm on my tippy toes, guys, because the lighting is pretty bad in here, but here we go. The average salary for a healthcare administrator is $95,000 in the USA, but it can range anywhere from $50K to $150K. And your education has to be a bachelor's degree, preferably in healthcare administration or some sort of business/public health, a master's degree if you want to be able to climb up that ladder of leadership. However, if you're like me and your background is not business, it's not impossible to get into healthcare administration. I did a biology degree, and through networking, I was able to find an opportunity where I am able to learn about healthcare administration and also obtain my master's of business administration and healthcare administration. So it's not impossible if you don't have a degree in those specific fields that you can get into this role. If you're into policy or politics and are very passionate about healthcare reform, etc., this might be a good role for you. And I had never thought that this role could be involved in healthcare in like a direct way, but I learned about it more this summer, so I'm going to tell you, and that is a government relations advocate or a lobbyist for a healthcare organization. A healthcare lobbyist advocates for patients and hospitals with legislative officials. So their job is to track legislation and educate officials on those issues that are going to be voted on so that they can vote, hopefully, to better the health of their community. They also build relationships with different community organizations and nonprofits to foster those connections and connect patients to those resources. And they help develop policy solutions or proposals for issues that may be impacting that community. This is at a local level, but also at a state and federal level. The average salary for this role is $63,000, but it can range anywhere from $48,000 to $80,000, and your education is not specific. You don't have to get a specific degree to get this role, but probably something in public health or healthcare sciences and things related to that are going to be helpful in your role. Remember, though, that a lot of the training that you're going to receive is based on your local community because a lot of the issues that are going to be voted on are probably impacting your community directly. So you might have a lot of on-the-job training to be able to learn like what's going on. A master's degree can also be helpful to be able to climb up that leadership ladder as well. This next one, I'm going to read the description for because I think every bit of it is important. I don't want to forget. So the next role is a healthcare navigator. So what is it? A healthcare navigator is a person who acts as a guide for patients, helping them navigate the complexities of the healthcare system by coordinating appointments, providing education, advocating for their needs, and connecting them to community resources to address the social determinants of health. If you haven't heard of what is the term social determinants of health, it really just has to do with where you live, your zip code, your economic status, your access to transportation and other resources, your access to food if you're living in a food desert, etc. So they are helping connect people who are in need in any of those areas to community resources that maybe allow them to fulfill the needs that the hospital is not able to fulfill for them. Average salary for this role is $49,000, but it can go up to $65,000. And for some of these roles, you just need a high school diploma, which is good because it's a beginner job. But if you can get a bachelor's degree in psychology or social work and things that, may help you in this role, then you could probably be more prepared as you step into this position. And the fifth non-clinical role that I'm going to share today is a community relations manager. So what is it? And it is a community relations manager is an individual who helps foster different campaigns, programs that help the community. So this is like things like food drives, blood drives, vaccination campaigns, education campaign, just things to promote health in the community. The average salary for this role is $57,000, but it can go up to $87,000. And your education to start in this role is a bachelor's degree in a relevant field, such as public health. So these are only 5 examples of non-clinical roles in healthcare. If you haven't heard this expression before, healthcare is like a city. So there is really probably all the jobs that you see in other big companies, they're going to have some sort of role in a hospital or healthcare organization. For example, you're going to have a finance department there because you're going to need to help patients with insurance, Medicaid, Medicare, etc. There's also going to be an IT department that's going to be helping doctors with technology and all of that. And of course, you're going to have environmental services who are going to be responsible for keeping the facility clean, establishing relationships with partners to have medical gowns and anything that has to do with like sheets and bedding that you're constantly throwing away. You're going to need people that coordinate those things and are informed in infection prevention and things like that. So there's really a ton of roles in a hospital that you may not have heard about that are non-clinical. If you haven't heard of some of these roles before, please let me know in the comment section down below. I would love to hear about it. I remember being in high school and I don't think I knew really about any of these except that you could be a lawyer and do stuff in healthcare, but that was really the extent of it. I didn't know that all of these different roles existed within the walls of a hospital. In conclusion, there are a ton of roles and a ton of opportunity for you if you're interested in healthcare, but you don't want to be a doctor, you don't want to be in a clinical role. That's okay. We got you. And if you're interested in that high earning potential, like a doctor, there are other roles in healthcare that you can also fulfill and hit those 6 figures. So no need to worry about that either. If you're interested in following my journey into healthcare administration, please don't forget to like and subscribe. And oh my gosh, say hi in the comments. I love talking to you guys. I always try to respond. So please make sure to leave a hi down below and I'll say hi back. And hopefully you guys can join me in this journey and I can educate you a little bit more as I learn about more healthcare administration and other roles that you can fill in a hospital that don't have to be clinical. Thank you guys so much for watching and I will see you in the next one. Bye.